video, I'm going to be introducing you to how you can use transcutaneous electrical nerve stimulation to stimulate the tibialis anterior muscle. This will be very beneficial for patients who present with tibialis anterior weakness, and as a result they have foot drop. Yes, foot drop means the inability of the patient to be able to lift the anterior part of the foot. So always the foot is in plantar flexion position, so the patient is not able to dorsiflex. Okay, yes, so this will be very important for such patients, and so I'm going to be using a very simple technique to help you out to be able to stimulate the tibialis anterior muscle in order to achieve full dorsiflexion of the foot. So kindly wait for me, I'll be back with more.
You are welcome back. Now let's begin.
In the case of foot drop, I'm just going to use my own leg for the demonstration. In the case of foot drop, a patient is going to be presenting with the foot being in this position, always in plantar flexion. Okay, the forefoot is in plantar flexion, and the patient cannot lift the forefoot this way. In other words, the patient cannot dorsiflex. Okay, yes. So to be able to achieve dorsiflexion with the transcutaneous electrical nerve stimulation machine, you have to know the origin and insertion of the tibialis anterior muscle. Now, the tibialis anterior muscle is the particular muscle that helps in dorsiflexion. So if it's weak, the patient will not be able to dorsiflex. Okay, so always the foot will be in plantar flexion position. Alright, so now the tibialis anterior muscle is a muscle that originates from
the upper two-thirds of the lateral part of the tibia. That is exactly this very part of the leg, and then inserts into the
medial cuneiform and the first metatarsal bones of the foot. So let's say around this part of the foot. Okay, yes, and then it starts from here. So in the case of the pad placement, when you are doing the pad placement should follow the principle that you have all the active electrodes placed here and the inactive ones around this area, or the insertion point, that is the upper part of the foot. That can also be effective during the application, but I will prefer placing the active electrodes around the origin, and then you place it once here. So we are going to do that for you to see whether we can use that to achieve foot dorsiflexion. Alright, so now this is the demonstration. So as I said earlier, you have to connect all the active electrodes here. So these are the active electrodes, reddish color, okay, and the inactive ones here. So that means if you connect one active electrode, you connect the other inactive one to the other end, in that order. Okay, so now this is how the placement will be. Okay, basically your achievement of the dorsiflexion will be more effective when you have the patient seated with the knee slightly bent. Okay, yes, slightly bent this way. Yes, and so we are going to use EMS option. So I will make sure I set my machine to the EMS option. Alright, so after switching to the EMS option, I also make sure I set certain parameters for the session. So I will go to the S, click on it. I will see that there is DAS under the EMS option. I make sure I place the blinking button on the D, and then if that is done, fortunately my own is on the D already, so I make sure I press the S again. It will come to the time cycle. I set it to 8 seconds. 8 seconds. And I press the S again. It will come to the time. So I want the treatment to take place within which period or duration. Then I set that particular time. Maybe 15 minutes. Okay, yes. Press the S again. It will go to the pulse rate. The pulse rate I will prefer using 300 microseconds. And I press it again. It goes to the pulse rate. Pulse rate. Pulse rate also ranges up to 130 or 150, yes, hertz. So maybe let me use 50. Okay, 50 hertz. And then I will press it again, the S again. It comes to ramp. I set my ramp. I just want it to ramp. That's the current should flow gradually every 1 second. Okay, let me make it 2 seconds. And press the S again. It comes to contraction. How often do I want my contraction to take place? 5 contractions, and then relaxation, 5 relaxation. So the contraction will occur 5 times and then relaxes 5 times. Now we are set. Let's press the S again. Wow. Now let's begin to increase it. So I have the patient's knee slightly bent this way, and then I start increasing it. Let's see what happens. You see the contraction. Let me move on to the other side. So the laterals are 4. That means each of the cycle is going to contract. It's going to follow the pattern in which the apparatus is being set to. Okay, so the contractions you are seeing is caused by the machine. Okay, well, so before you can achieve effective dorsiflexion, make sure as the machine causes the dorsiflexion, the patient should also voluntarily contract that in that pattern. Okay, yes. Okay, so viewers, this is how the stimulation is being done. Thank you so much. Make sure you subscribe to this channel and like this video, give us your comments, and also share to your colleagues to also have a look at how this technique is being done.